Well, one of the Republicans who plans to vote yes on the health care bill is Congressman Gregg Harper of Mississippi. Congressman, you're joining us now. Thank you so much for stepping away from the fray and giving us a little bit of time. You have said that there is no immediate silver bullet to fix the health care system, but that this bill is at least a move in the right direction. Why do you say that?
You know, look, there's never any perfect piece of legislation, but this one goes a long ways towards resolving. It will repeal and replace Obamacare, and it puts us on the path. Along with this, the fact that we have Tom Price doing a tremendous job as HHS Secretary and being a physician, and then other things to do that'll improve the cost of health insurance, which has been a disaster under Obamacare. So this is something that I believe that at the end of the day, I think that we're going to pass this. I believe we'll have the necessary votes to get it done. It may be tight, but I think it's going to be very hard for a member who says they want more to tell President Trump no. They might be able to tell Speaker Ryan that, but I think if they're in a district that President Trump carried by 30, maybe 40 points, and he's pretty serious about it, I think there are certain members who are probably taking a big risk to think that this is, that we're going to continue negotiating. It's a pretty high-stakes game of chicken if this is what they're going to try to do.
Congressman Harper, OMB Director Mick Mulvaney was on CBS this morning earlier, and he was asked a question. If you want to live in a state that wants to mandate maternity coverage for everybody, including a 60-year-old woman, that's fine. That's what he said. Then he was asked why. What about a state that doesn't do that? And then he said, then you can figure out a way to change the state you live in. And he went on to say they should try to change their own state legislators and state laws. I mean, people get sick. The same sicknesses that affect one person in one state affect the next person in another state. Why should people have different coverage state by state?
Well, I understand, but one of the main complaints of Obamacare has been that you've been forced to have certain types of coverage that you didn't need. So this will give flexibility, which should drive down the cost of the premiums over the long run. And each state can decide that. But I think most folks would agree that probably a 57-year-old might not need maternity coverage. Well, under Obamacare, you're blocked out of some of that. But look, for me, I was always taught that use your common sense. Don't turn down the very best deal you can get because you want something better and then wind up with something worse. So we have a great opportunity here, I believe, to have a profound impact on people's lives.
You know, Congressman, a lot of people have asked the question, though, what's the rush? We're talking about a massive piece of legislation. You know, your constituents in Mississippi, Mississippi has the nation's highest rate among the highest rate of uninsured or underinsured people. It's really important to get this right. Why work so hard to do it now? Why not take time and maybe spread out the negotiations over several months and get it right?
Well, and that's a great question, but I think the negotiations have been done. We've gone through all of the process. This delaying it won't improve the position here. What we have is, I think, people that believe that if they keep negotiating, maybe they'll get more. I'm not sure that some that are opposed to this on our side can really articulate what it will take. But we are working under the constraints of the budget reconciliation, and if this is voted down, we can't come back to it. I think that President Trump has shown one thing. He's keeping his promises, and he's made it pretty clear to some of our members. And look, I'm conservative. I'm just not mad about it. We've got an opportunity here to do something very special, and I hope our members will see at the end of the day that we can take care of this.
Congressman, explain to the American people, I mean, for those folks who voted for President Trump, who were voting for him because he made the promise to repeal and replace the Affordable Care Act, why, after 7 years, is the Republican Party still stuck on the details? Why, after 7 years, have you not been able to come up with a plan that everybody agrees on so that you can place the vote and get a win?
That's a fair question, but let me say this. You have people represent their individual district from many different states and different backgrounds, and it's a difficult job to get everybody on the same page to agree on anything. So we believe, though, at the end of the day, the work that's been done here, it makes sense, and you have to ask people across the country, do you believe your health care is better today than it was 7 years ago? And an overwhelming majority would say, no, it's not. And does this bill make it better? And it will. And you've got to accept that. And, not let perfect be your enemy here. And let's get this bill passed is what I would say to our colleagues on the Republican side.
Congressman Gregg Harper from Mississippi. Grab yourself a coffee. It's going to be a long day for you. Thanks a lot.
It will. Thank you.